Yay. Oh my goodness. That's a first. Okay. So we'll go ahead and get started. The treasurer's report, we have a balance of $2,219.19. We have, for item number 2, recruitment and retention of mental health board members, we have 3 vacancies, 1 in District 2, 1 in District 4, and 1 in District 5. So Rabbit, Gore, and Hopkins all have vacancies. Regarding that, I'm going to put together a letter to the supervisors, reminding them of the requirements. And it also came to our attention when we were looking at the data notebook that we have made no outreach to the Asian Pacific Islander population, which is small, but I'm going to include that we need to make that outreach if possible. The minutes from November 16th, I think you have received. I'm going to have to look back in my emails to see, but those will be approved at the January 18th meeting. So please be sure you read them. Excuse me. We're also responsible for doing the ethics training. And I know that with those busy holidays, I still have to do it. So I'm assuming that some of the rest of you may be with me. So remember to do that. So January, on item number 4, January is usually the East County presentation, but Carol, you have some information about the South County Petaluma Police Department, and I believe you invited him to speak. Is that right?
No, I didn't invite him to speak. It was really leftover correspondence from the South County outreach when we did the South County Mental Health Board meeting in November. And it was an invitation to join us as a participant at mental health board meetings so that he would know what we were doing. But it was maybe a potential contact for the SAFE team. He works with the SAFE team in Petaluma. So it's Lieutenant Nick McGowan. So it's really just an invitation to participate. It was not an invitation to talk, but it can be whatever we want it to be. You know, it's basically just a point of contact and an invitation. So I was going to offer him the link to this meeting for him to kind of attend. But if we'd like him to talk, that would be an additional conversation.
Okay, and did you share the link with him?
I have not, because I didn't have it yet for the January meeting.
Okay.
It was not yet available.
Okay, so you will be sharing that link with him when we get it?
Yes.
Okay.
So
And
it's really up to the rest of the group as to what that might look like in terms of, you know, do we want him to say something or not?
well, I think it would be a good presentation at some point. So we do have to talk about what our future presentations are going to be, and this month. And I see that Betsy isn't here, and neither is okay.
No, I'm here. I'm here, Kathy.
Yay! I didn't see you.
Okay.
So you had said that you were going to look at getting some people to present on East County issues.
Yeah, November 19th. I mean, on the 1st and the 19th of January, correct?
I think, well, she has the 18th written down.
Oh, is it the 18th? Shoot.
Yes.
Okay, I'll make sure. Yeah, I've done some feelers. I've sent out some feelers. And maybe the date of the change of date will help, because I think I put 19th. I could be wrong. But somebody had said that they had a board meeting themselves to attend that day, so maybe that would help. Oh no, I did have a January 18th. Okay. I do think that we'll have some folks coming in and either participating on behalf of the organization that would be able to share of what they're doing. So I'm hopeful. Do you need a definite answer by some time of who will be attending?
I don't know that we need to know exactly who's attending, but we need to know that there's somebody attending, that you're working on it.
Yeah. And actually now I think Karen, you and I did a presentation not too long ago, and I wonder if there could be a follow-up to that, just because there was, I think that there was a good amount of folks in the audience that wanted to learn more about what you spoke about. And I guess I'm making it
Mobile support team. Okay.
Yeah, the mobile support team, what they do specifically here in this area, because there was some interest in learning more. So maybe we can bring that back to this place and share the video with folks, or the recording with folks who are interested in learning more. What do you think?
Yeah, I think that's a great idea.
Okay. All right, so I'll reach out to you.
Okay. So this coming meeting should be, it should be covered with East County things. And then yes,
Kathy,
Carol?
I was just wondering if I'm not sure if he will come. I think he is intending to come. This is the Lieutenant McGowan. I'm just wondering, even if he's not speaking, if we can maybe just do like a welcome and introduction, like maybe 2 minutes.
That's a good idea.
Just to acknowledge that if he takes the time to attend the meeting, that we see him, and we'd love to kind of take next steps, whatever that is.
Uh-huh. I'm writing,
Mm-hmm.
so I don't forget.
Yeah, because while we don't have an active group right now at the mental health jail, that's something, and I don't know if that's on the agenda for later. Maybe I can just kind of put that in for later. There's a lot of emails coming across my desk around reform, and don't want to forget this new mental health unit that's being built at the jail and how we might be involved. I mean, we did lose the contact with Dr. Robert Travel, Lieutenant Travelstead, but I'm sure we can kind of find someone who's replaced him, kind of continue that conversation.
We should do that. And I know we talked about having a presentation, but I know that we talked about with the turnover of personnel, that it wasn't a good time then to have a presentation, but maybe if more contacts can be made with them, maybe there is a possibility of them presenting.
Yeah,
on that.
Because as part of that conversation, my understanding is that there's a new sheriff election. I know we cannot be directly involved with who is elected, but I think certainly promoting the opportunities to learn about the candidates seems really important, so that when people do go to vote, they have a sense of who they're voting for. And certainly for us as board members, it feels really important that we are aware that this is happening, because I think that that has a huge, could potentially have a huge impact on the leadership around law enforcement and behavioral health.
Yes, there's going to be major changes coming up with Bill leaving as well. So I don't think that we can really have candidates present at the board meeting, but I think we can let people know where their forums are going to be and when. So I'll put that down.
The homeless action community are very active in trying to help people become informed about who the candidates are. So I can try and keep people informed of where those presentations will be. Yeah.
Okay.
I know we cannot get involved in saying who
Yeah.
we want to be elected, but
Yeah.
I think it's an important process that we need to be aware of. Yeah.
Okay, so let me do this really quick. I'm looking at the schedule. Number 8 is scheduling of special presentations. And I think that since it's on my mind and you just brought up the homeless, the transition to housing by West County Community Services is willing to make a presentation on what they're doing. And so I'm thinking that that might be a possible presentation for for March. I'm going to put that down as a possibility. And if you have other possibilities, you can bring that up. February, I know that Vanessa and Michael are working on a presentation. And when we get there, I'll have Vanessa, I see Vanessa's here and she can describe more what they're doing. But that's more a reminder to me.
And sorry, Kathy, to interrupt. I see that Michael is here as an attendee right now, but if we can add him as a panelist, if that's possible, or Tori. Yeah.
I got it.
Okay, thank you.
Thank you.
And can we add to the list of presentations, and it doesn't have to be urgent. I don't think it could be later in the year, would be a follow-up on the new mental health jail unit.
Yes, that I think once you make contact with, well, I'm assuming it'll be you because you were part of that committee with Mary Francis, but once we know who we have the contact for that, then we can schedule it.
Okay.
Okay, so I better get back to the agenda before I miss things. Okay, number 5 was Behavioral Health Director's Report, budget update and systems transformation. And I think that Sid and Karen, I think you are the ones that are going to report to us. So whichever one of you wants to go first.
I vote Sid.
Haha. Okay, Sid, you're on.
So sorry, I was looking at our assignments from Bill, and I think I'm actually I'm not actually sure. I mean, I know I'm supposed to give the presentation about the diversion program coming this month. And I think that might be why I'm here today, because I don't see myself on the list as supposed to, that I'm supposed to be in this meeting today.
Yeah, it was actually Karen and myself, and we were going to be talking a little bit about youth treatment as what youth services that Bill had asked us to present on. So I don't know if that's changed or something, perhaps it has, but I'm happy to, connect with Karen on that. I don't know if Karen, if you're prepared to speak to some of the youth services updates or what's happening on that front.
So I think that what Bill was doing was asking you to update on areas that you're familiar with, which is why there's 3 of you and not 1 of you. So if each of you presents, what you know about what you are doing and are familiar with, then we'll have probably a pretty good picture. Okay, so let me see.
Okay, so do you just want me to start? I'm completely not organized to do
Well, I'm fine with any one of you starting. So let me see. I have not met before Melissa, I believe. And she sounds like she's ready to talk about the youth program. So let her go first. And you can be thinking, Sid.
That's
Great. Oh, thank you so much. I'm happy to be here. Yeah, Bill has asked us to be here and to help support the efforts here on the mental health board. So I am the new substance use disorder community resources and services section manager. So I'm excited to be here. And I think the big updates that I just kind of wanted to discuss or talk about was the move towards the county moving towards the drug Medi-Cal organized delivery system. And as part of that move, there will be a lot of integration and services that need to be joined together. So this is an opportunity really to be talking and being part of the mental health board. So I was excited to have the chance to come here. One of the places where we're going to be doing a lot of work together, and this is I'm excited in getting to work with Karen on this, is that we're building out our youth treatment services. So through our Measure O funding that was allocated for some of the substance use disorder services here in the county, there was a focus on youth treatment, which is exciting. And so looking to do some real integrated services there, looking at possibly a school-based program. So in the process right now of researching what options we have in conversation with a lot of different groups to do that, to build that out, and have started some communication with the superintendents of certain school districts, which has been great, including also some board of supervisors have attended that as well. So there's a lot of discussion happening and a lot of effort around that and building that out. We did just find out today that we received a planning grant from the Department of Healthcare Services around these large infrastructure grants that are coming down the pike. There's some that have already come out, one for mobile support services, but also there are some additional building rehabilitation capital grants that are coming. And this planning grant is an opportunity for us also to come together and talk about services and ways that we might be able to expand services in our county. So it's a chance for us to develop a committee, have those conversations, and continue to do that. So that's really the focus. There's a lot happening. I'm really excited about a lot of the work happening. And even with Bill here, not here now, we're looking to continue to do that and move towards that, move towards the organized delivery system. It's quite a shift in our SUD services here. And there, like I said, there will be a lot of opportunity for integration with mental health. So that's my update. I don't know if you have any questions, I'm happy to answer that as well. Or Karen, if you want to add to that around the youth treatment.
Well, why don't we take any questions for you, and then I can talk a little bit more when I talk about youth services.
This is a question. I'm wondering if there are any plans to include youth peer support specialists in the SUD school-based programming.
I'm looking overall at a peer support program for SUD. So I'm actually, I know with the new certifications that are happening, there's a lot of effort to, SUD is really well situated for that as well. As you can imagine, we have quite a few folks currently in our services, the handling and doing service delivery that are with lived experience. And So it's really well situated. There's a lot of experience with that and SUD. It's very much part of our community and the work that we do. So I'm very excited to see how we can build that out further, especially giving like, the formal approach to the peer certification process. So I don't think it's something specifically that we're looking at. I'm looking at it overall for the entire SUD continuum of services. So I think it is an option and something down the road, but I do appreciate you bringing that forward. And it's another option to kind of look at that holistically and see what options we have for peer support.
Thank you.
Yeah, thank you. Notes.
Any questions? Okay, there may be more in a minute, but Karen, you want to go ahead?
Actually, so there's a question in the chat by Mary
Oh.
Francis.
Thank you for
it
looking
says-
at the chat.
It says, can you be specific as to the name of the new medical drug organized delivery system? Another question, sorry. Is this about services for medical population only? Are there plans to look at expanding services for adults as well as youth? Thank you,
Yes.
Mary.
So that it's drug Medi-Cal. So it's part of our Medi-Cal, Medicaid services. This is a focus on substance use disorder treatment services. And also, so it is focused for our Medi-Cal clients, but the building out of the system has an impact and benefit for the entire continuum of services, both on the youth side and on the adult side, but also for our non-Medi-Cal clients as well. So what it does, it opens up by being able to bill to Medi-Cal, to the state Medi-Cal, we're able to open up some funding that we've had to reserve that hasn't been currently covered under our state plan that we have. So we haven't been able to bill for services. We've had to take a lot of our discretionary funds, some of our general funds to pay for services. So by being able to bill to Medi-Cal, we're opening up services. This can, it can boost across the continuum, whether it can increase our prevention services, I'll call another drug prevention, all the way through the continuum to include also non-Medi-Cal clients as well. But that is the primary focus, but it does have a larger impact. I hope that kind of clears that up.
I have a question about services in general. Is this going to allow you to, you talked about youth services, but I'm wondering about services in general. Will you be able to do some expansion?
Yeah, I brought up youth services because we had done an SUD mapping project for the county. And we really looked at where our larger gaps were. And that was kind of where we were going to start, was around building out. But simultaneously, we need to look at the entire continuum, but there was a significant gap identified in our youth treatment, really just not just here, but across the Bay Area, really. We're having a challenge finding residential treatment services and outpatient treatment services on the SUD side. So that's kind of where it's kind of a idea of thinking that's where we're starting the prioritizing, and there happens to be some additional funds from Measure O, but that doesn't mean that we need, we still need to build out adult services. We need to look at our whole continuum and see where we can build out and make sure we have the proper level of care available to our clients. So yeah, so it's something across the board, but I just brought up youth because there's an additional emphasis there, and there's also some Measure O funding that's been allocated for that as well. Yeah. Thank you, great questions.
Thank you.
Melissa, is there a way to access this report, the mapping report that you referenced?
Yeah, we did present it to quite a few different community stakeholders, and I'm happy to bring it here if you'd like to see kind of the results. We had focus groups, we conducted a survey, we had key informant interviews. We actually also connected with other counties who had moved to the organized delivery system and looked at what their kind of pain points were and how they addressed some of the challenges they had in their county. So all of that information is available, and I'm happy to deliver that. If it's something you'd be interested in here, I could come at a later date and bring you the results and the findings of that report and that project that we did. I see a thumbs up, so it sounds like that would be really beneficial to see all the information. Yeah, it was very informative. I was really appreciative to all the folks that came, and be part of that conversation, larger conversation, and it illuminated us. But I think a lot of us were very understanding of where those gaps were. But it was great to hear that and have that, specifically hear from the stakeholders in our community. So yeah, so just let me know when you'd like me to come back, and I'm happy to do that.
Right. I do see that Mary Francis has a hand up as an attendee. I don't know if she wants to.
Okay. Let
Say.
me see. Okay, Mary Francis, you can talk.
Sorry, actually, I had it up a long time ago. So my question, we've kind of moved on to a different subject, but my only question is the report, Melissa, available online?
It is not yet posted online. I have a PowerPoint presentation that I can present on and just kind of, give our key findings. So I'm happy to do that. I'm happy to, circulate that PowerPoint. I think it's probably best if I can present to you the different phases and how we did the project and what we learned from the project. So that's probably the best approach, is to do a PowerPoint here. If that's an option.
I think that would be great if you would do that. Thank you.
Fantastic. Sure. Happy to do so.
Okay, so to the board and any other people that are have an opinion, should that be done at an executive committee meeting, or should it be a larger presentation? And that's a question as well for you, Melissa.
I'm happy. I'm happy to get the word out. I think if you have a larger group you'd like me to present to, I'm happy to do that. I really think it lends to the part around the integration, because that was one of the findings, the need for future and stronger integration between mental health and substance use disorder treatment services. So I think it makes a lot of sense if we're doing it to the larger board, so they can see that the community has really spoken about this as a need and something we want to be able to focus on. And there might be ways that the board itself can find some ways to integrate or do some things here, projects that might help that, move that along. So yeah, so I'm happy to do it anywhere you'd like me to do it.
Okay, Carol?
Yeah, I think it sounds like a big shift that's happening, and potential growth and opportunities. And I think it would be awesome for us to do it at the bigger meeting, and to make it a public facing presentation. Yeah.
Yeah, absolutely. We worked with a group of consultants on this as well. We really wanted to make sure we had a lot of stakeholders come to the conversation and be part of this discussion and really get enough data. We also looked at, actual data sets that we had, trends in our community around substance use disorder. So I think that's would also be very beneficial to folks to hear what's been happening in our community. And there's a lot of information right now, especially around like overdose and, opioid and fentanyl use. So that would be beneficial to hear about that as well. So thank you.
Okay. Any more questions for Melissa? Karen, you're on.
All right. Well, I'll just give you a brief overview of what we're working on in the youth and family section right now. We're working very hard at hiring, which I think is true across the division. It's tough going these days with our recruitments. So we have a number of ongoing recruitments. I feel like we've been interviewing for months and months and months and months, and we continue to do so. We are really trying to focus on increasing the diversity of our staff at Youth and Family, and we're having some success in that, which surprises me a little since we're having such a terrible time overall recruiting, but we're working on that. And then we have some directions that we're trying to go in that we will be moving towards as soon as we have staff to do them. One big undertaking that we're planning on taking on when we're staffed is we're going to be training the majority of our youth staff in an evidence-based family therapy model, probably brief strategic family therapy, it looks like. That's going to be a pretty significant undertaking, and we're really excited about that. That also happens to be an evidence-based practice that's listed on the list of acceptable practices under Family First Prevention Services Act, which is a new funding stream coming through Human Services through Child Welfare. So we've been working closely with them in that planning process, and it seems like those two things may dovetail nicely. We're also really hoping to increase our partnership with school systems in the future. We have had close working relationships with the schools in the past with our CAPE program, which was cut back in 2017, I think. I don't know that we will be doing that again specifically, but we have met with a group of superintendents. Melissa was there to hear from them about what kinds of partnerships and services they would like to see in the schools. And we are presenting to the ad hoc committee some recommendations about what we think we could do with Measure O funding to increase our partnerships with the school system. So hopefully we'll be doing more of that in the future. And then the other kind of big thing that we're planning on putting out an RFP for sometime in the next several months is for therapeutic foster care, which is a very high level of a highly supportive level of foster care that's kind of just under a group home level of support for kids. So what we'll be doing with that is we'll be contracting with a community agency who will then train foster parents to actually provide some behavioral health services and document those services to Medi-Cal. So that'll be an interesting process. It is a level of service that we need to have. We've been talking with a lot of other counties about their experience. There's been some trouble in other counties getting agencies interested in providing that service, but we do have a couple of nonprofits in our county already who do that service in other counties. So I'm hoping when we put out our RFP, we will have some response to that. And the hope is that it will decrease our need for residential placement for kids and enable us to keep more kids in county instead of sending them out of county. So those are kind of the big things that we're working on. And as I'm saying that, it occurs to me that we are now also putting together some monthly data that we're bringing to one of our fiscal meetings about kids who were serving mostly in residential placements, kids who are being served here in residential placements, and kids who are being served out of county in residential placements. And we have a fair number of Sonoma County kids who go out of county for residential treatment. And there's a fair number of kids from other counties who come here for treatment. And it's just kind of interesting to look at that information. So if that's something that you'd have an interest in at some point in the future, I'd be happy to bring that to you. So that's kind of a brief overview of what's going on at YFS right now. The other thing that it maybe is worth mentioning is the mobile support team is moving from my section to Sid's section. So that switch just happened a few days ago, and I still haven't caught up to that in my brain. So just so you know, future contact for MST related things is now Sid. Yay for Sid. So if you have any questions about YFS, I'd be happy to answer them.
Carol?
I was wondering if you have any connection with the Sonoma Connect ACEs Aware project. It seems like a lot of overlap, and that many of your children would in fact have already been screened for ACEs, or if not, would be potentially in line for the support services there for the parents. I think the idea is to create support services for the parents to protect the children. So yeah, is there a connection with Sonoma Connect and the ACEs Aware study?
Yeah, that's a good question. We're certainly aware of them. And ACEs is something that we do talk about, but we don't have any sort of official connection with them. But I could certainly reach out to them and see if there's any availability for us to work more closely together. That's a good idea. Thank you.
Okay.
I was going to suggest that we have Melissa do her presentation following having Ariana Arizon provide some information on the Sonoma Connect, because I do think that there is a lot of intersections that are happening, and perhaps after hearing Melissa's presentation, there could be more of a dialogue as to how that connectivity could happen, or that intersection could happen.
Sounds great.
Yeah, because I think part of that conversation really, for me anyway, is what is the role for community health workers and the overlap between peer support specialists and community health workers. I think they've been very successfully used in that grassroots point of contact with families, and especially if they are people chosen with lived experience themselves, either as parents who've been through the foster care system or have been foster parents themselves. I think that lived experience component can often be that glue that helps to kind of bond people together.
Yeah, absolutely. One of my wish list items at some point is to incorporate parent partners into our youth system. So I definitely think that anything we can do to start moving in that direction would be fantastic.
Yeah, because I think the why that's important right now is there is a flood of money that's come into California to support growth in the community health worker workforce. There is, as you know, the peer support specialist certification coming up. And our local county, our public health department, through Kim Calderway, applied for and received the $2 million for this year, and then 2 following years, each with $2 million for workforce development for community health workers in Sonoma County. So that might be something just to keep in mind for expanding your workforce if you feel like it's relevant.
Awesome.
And I want to comment that I went to a workshop, and I can't remember exactly what it was, but it was a foster care mental health type workshop. And they did have a woman presenting who was a peer who had been through the system. She was a person who had her children taken by the foster system and then worked to get them back. And she was actually she presented. And so I don't know exactly how she was involved and what, whether she was being paid in any way as a peer provider, but I know that those people are out there. So that's a good suggestion.
And a comment I had too was, I forgot to mention that we do already actually work with Competency for our alcohol and drug prevention work. We have a whole plan in place and already has started doing parent education and working with promotores and parents to train them to become, in essence, kind of a community health worker approach where they would be talking to other parents in the community and really teaching about, like, especially around cannabis prevention. We're doing a lot of training around cannabis, but also SUD prevention work as well. So just wanted to mention that too, that is already in place and that's already happening.
Mm-hmm. And for those, if you know anyone who would like free core skills competencies, if you are already working with individuals that are doing that role, part of the funding will pay for including education support and language support through City College of San Francisco, a core competency training for community health workers. And I can certainly send information to anyone who's interested. Otherwise, you can contact Kim Calderway directly. I think it's starting in February. It's a 3-month training and you come out with a certificate at the end of it.
And would they be only for community health workers? Like, for example, the promotores aren't necessarily, identified as, I don't know if they would qualify. I'm wondering if that
it's anyone who's doing the work. Yeah.
Great.
And the kind of challenge is language. So many of the promotores, if they are Spanish only, it can be a challenge. There will be some trainings coming to the county that will be in Spanish, but won't be related to the certificate. But if they can manage the English, learning in English, then, and there is some learning support if English is a second language, but they do not have to have the job title of community health worker.
Great. Okay, that's really good to know. And so just talk to Kim Calderway to get that access to that information. So I want to make sure I get it out to the promotores so they know about it.
Sure.
Thank you so much.
Absolutely.
Okay, any more questions for either Karen or Melissa? Okay, so Sid, do you have?
All right, I'm organized. Sort of.
Sorry.
So just a couple of sort of bigger picture items are that for many of our mental health programs, we are bringing people back into our facilities who have been working at home. So that's sort of an ongoing process. And we're working out kinks as we go along, and we're doing it in sort of a hybrid model, but we have a lot more folks on campus than we have prior, at least here at the Lakes. This is being very complicated by this new Omicron COVID outbreak. Many of our staff are out throughout our programs. I think a lot of people are being impacted, especially because of the holidays. And so, you know, just as everyone in the population is being affected by this, so are we. So that is impacting services, including the CSU, which, you know, both of our CRUs are shut down to referrals right now because of COVID outbreak, as is Marin General Hospital. So we're having a little bit of a bottleneck issue in terms of getting people to where they need to go. Then since I'm talking about the CSU, we've, gosh, a year and a half ago, we were supposed to increase to 16 beds at the CSU. And we have been unable to due to really significant staffing issues. And the way that's been going is that since COVID started, you know, we've had staff who have been in, you know, a pretty stressful environment. And we've been not had enough staff, like a lot of staff had to leave because of COVID, people who maybe were immunocompromised or older and never came back. And then hiring really lagged. And we're still trying to catch up from that. And then we've had people leave in between too, you know, that whole work-life balance thing that a lot of people are doing during COVID. So, so the staff who are remaining are doing a lot of overtime, and then they're getting burnt out or they're getting sick. And so we have a lot of call-offs. So we have had to really significantly lower our census for the last couple of months, down to more like 8 beds than 16, which is impacting throughput at the EDs. It's making our hospitalization rates go way up. People who we would normally stabilize and send to maybe crisis residential or send home are being hospitalized because they have to get out of the ER and they are in a psychiatric crisis. So it's not good. None of that is good. The only positive note on that horizon is that the psychiatric health facility is slated to open on January 21st. And that seems to be on track. We're still doing a little bit of contract negotiation around that, but otherwise they just yesterday got approval to be an LPS facility by our Board of Supervisors. They I think they're on track to, you know, have their licensure done by the state, get their Medi-Cal certification done by us, and there's going to be a ribbon cutting on the 20th. I hope you all have been invited to, and then they should be opening for business on the 21st. So fingers crossed. That should really significantly help our throughput issues at the CSU. Not so many folks will be getting stuck there because they don't have a hospital bed to go to, and then we'll be able to bring more people in and just move people through more quickly to where they need to go. Other things that we're working on in the acute and forensic section. First thing, I actually oversee our nursing services as well. So one project we're working on is bringing a pharmacy to our behavioral health campus. I don't know if you've heard about this before, but there's a pharmacy called Genoa Pharmacy, which specifically just works with folks, behavioral health organizations, locates their pharmacy on site, and they're way more flexible based on the needs of behavioral health clients. So if someone just needs 3 days of medication because having more than that at home would be unsafe for them, that's what they'll do. If someone loses their medications, they will be helpful with that. So that will really impact, because right now our nursing staff spend a lot of time just doing inventory with meds and organizing our medication room and things like that. So that they won't have to do that anymore. They won't have to fill medisets anymore. And they can be much more involved in providing psychoeducation and doing home visits and running groups and doing medical case management, which is something we need to significantly step up, especially as our population ages, and you know, primary care providers still don't understand the specific and unique needs of behavioral health clients. So having our nurses way more involved in that will be great. So we're working on that, and then we are putting together the program and the housing for the diversion clients, the Pathways to Hope. Wait, is that what it's called? Crossroads to Hope program that I'll be talking about at the mental health board meeting this month. Where Melissa Ladresh and I will be bringing our project to the OAC next month, and it has preliminary approval, and then we have to present it, I guess, to them, and then we're going to be putting out an RFP, I think, this month for the peers to run the 24-hour program. The house is on Sonoma Avenue, right next door to Creekside. And so we're working on transitioning that. It's owned right now by the county with the Community Development Commission, and they're going to be transferring it over to us. And so behavioral health with our CHAPA grant will be paying for that, and they'll be giving it to us, selling it to us. And it's a wonderful property. So we're very excited about that. So that program should be up and running by June 30th. That's our commitment to the CHAFA board. We are, let's see, the In Response team started operations 2 days ago here in Santa Rosa. And I just have an email into Wendy Tappan to say, hey, how's it going so far? She's the program manager for the mobile support team. And and that I think you all have heard about is a partnership with the city, so that the city is supplying a paramedic, Catholic Charities, and behavioral health. So there will be 3 people on each van going out to anyone within the city limits who's having a behavioral health crisis. And then Buckaloo is involved as well to do follow-up with folks and make sure they get connected to resources and services. So it's a really nice partnership, and fingers crossed that all goes very smoothly. And it will be, it's ramping up kind of slowly, but will be not really slowly over weeks. Folks are increasing the schedule until it'll be 7 days a week. And let's see what else. We're working with Santa Rosa Behavioral Health Hospital, formerly Aurora, on creating a psychiatric intensive care unit, or they're working on that. We're adding that to our contract. So, there has been this issue where folks who have to leave their facility or get stuck at the CSU because part of their mental health symptomology is that they're assaulted. We don't have a hospital anywhere in California who will take those folks. So they often get stuck at the CSU or go to jail. So Santa Rosa Behavioral Healthcare Hospital is creating a psychiatric intensive care unit specifically for those kinds of folks, with enough staffing to be able to work with folks with assaultive behavior. So that will be really helpful for our EDs and for the CSU as well. And I think that's enough for now. Sorry, big issue. Our medical director will be leaving by June, Dan Bleeman. He's going to be retiring, moving to Reno. He's pretty excited. And so I'm working with Merritt Hawkins, is a contractor who specifically does nationwide searches. And they're going to be helping us find a medical director, as well as some other psychiatrists that we can direct contract with because we're very short on psychiatrists right now. And in terms of Bill's replacement, the position is open with the county until January 10th. And then after that, there will be really, I think, what's the word I'm looking for? Robust interview process to find our new behavioral health director. And until he's, until that person is up and running, we will, Tina Rivera is acting as behavioral health director, kind of, and then us section managers are doing a lot of the things Bill normally does. Okay, now I think I'm done.
Okay, questions? And thank you. Carol.
Yeah, I just had a question about the PUF, whether the funding was found or there was an agreement from the hospitals, or it seemed like the last time we had a report from Bill that there was still some outstanding funding for the running of the PUF.
Yeah.
And have you managed to solve that issue?
No, as far as I know, we
you
have not solved
personally,
it.
yeah, no, not you personally, but in general. So that's still outstanding. Okay, so maybe we can just keep an eye on that and have some updates, because we were concerned that they were going to sell off some of the beds to other counties, and that would be very sad if we have to do that.
Yeah, I haven't heard anything about doing that. I think I want to say it's a $250,000 shortfall, and I'm not sure what we're doing with that yet, but I can certainly ask what the update is and maybe give you an update. Well, I'm not sure how I do that, but.
So I have a minor comment question on the PUF. I work Thursdays, and January 20th is a Thursday. And I don't remember seeing an invitation to the ribbon cutting, but some people on here may be interested. And I don't think that I saw an invitation come across my emails. So
Okay.
if there may be people interested. I know that I would not be able to come, but definitely there's some that might.
I will forward to Tori to forward to you all. And I'll do that right now.
Pardon?
I'm forwarding to Tori to forward to you all.
Okay, perfect. Yes.
I'm not sure if you can see Kathy, but Michael has his hand up.
Michael.
Yes, Sid, sorry if this was answered. I don't think it was. I had to step away for a second, but the new facility being built, I think term it would be, is it like an inpatient care facility with beds and stuff like that?
Yeah.
So it's for like, 5150s and stuff like that. I guess my questions would be in two parts. Is how many beds are there, and is there an area for the patients to step outside while they're on the hold?
Yeah, good questions. So there are 16 beds altogether. 2 are going to be contracted with Marin County. 14 will be specifically for Sonoma County, and they are guaranteed beds for us. We have, we are paying for the beds, whether they're full or not. So we have 14 beds for Sonoma County Medi-Cal beneficiaries, so that we don't have to send them out of county all over the place. It is an inpatient psychiatric facility. They do have an outdoor area. It's in a beautiful setting too. It's up at Los Galicos.
Great.
And there will be an outdoor area for people to be able to use. And there's a lot of natural light in the facility as well. There's a lot of skylights and stuff like that.
Yeah, definitely the facilities that had like access to the outdoors were always a lot calmer and like more relaxed to be in. So it's like super important, I think, compared to
Agree. That's one of our problems with the CSU, that we don't have an outside place.
yeah, for sure. Cool. Thank you.
Yeah.
Mary Frances.
Oh, thank you. I just wanted to confirm, you mentioned the program lead for MST. Are you referring to Wendy Tapon? Or is?
Yes, sorry. Yeah.
Yeah, that's okay. Thank you, Sid.
Okay, and I heard, I'm going back to this January board meeting, and Karen was asked to present about the mobile support team, but I hear that it's now yours, Sid. So you guys can work out which one of you is doing that.
Yeah,
So
I'm sure I can take that on.
yeah. Okay. So any other questions for any of the three people who are taking Bill's place at the moment? Okay, I don't see any hands. So thank you, the three of you, and we will move on to the other reports. Home board, ad hoc committees, legislative agenda items, Pam and mental health services. Do we have ideas for other facilities to visit and volunteers? I think the biggest one there is that Bob Hale had been, he had really taken on the site visits and really had been doing an awesome job of the visiting. And he is experiencing some health problems, which is preventing him from attending these meetings, but it's also preventing him from, I think, being active in the site visits. So we need to find somebody to take that on from among us. And I'll be sending out emails to ask for help with that. Until we have somebody ready to take it on, I don't think that we can really schedule any site visits because we don't have a lead person at the moment. So I'll be looking for somebody who is willing to do that. Carol, did you have anything else about the jail? Or Mary Frances, you could chime in as well.
Not other than it feels like an important part of the services that are offered to behavioral health clients. And it is still a black box since it's WellPath that delivers those services. So I think it feels very important that we try to continue to build that relationship. COVID has certainly put a spanner in the works there, but so the short answer is no update, but want to keep it squarely on the radar as important. So
okay, and Sid, you're working with them, right? Because of your transition housing and all of that. So maybe if you have ideas of contacts for us, maybe you could let Carol and Mary Frances.
Yeah, Carol, maybe we should speak directly.
okay.
Yeah,
and would like to invite Mary Frances to continue to be part of that, because and I'm not sure if Bob Hale is up for it, but he was the third person.
right.
I would love to be involved. I just want to add that there's just sort of from calls that we're receiving from families, sort of an uptick in concern about people who may fall into that very acute psychiatric crisis mode, who are also assaulted, from families who are in fear. And this relates to somebody that has for example, schizophrenia and has been in the jail, and their crime, for the reason, their alleged crime is not sufficiently heinous enough, as one family member put it, and it looks like they'll be released from jail. But these are chronically ill people who have been in and out of jail and had the mobile support team or wellness checks multiple times. There just is a small population out there that is really suffering, and I really would like to see the Mental Health Board be informed and keep on top of this. And I will just also mention, we're going to have a new district attorney, so that's another office to keep our eyes on, somebody who's dealing with those with acute psychiatric illness who are in the jail system. And I just think the Mental Health Board really needs to stay on top of what's happening with this. In addition, I just will mention that the California legislature recently held special hearings on the LPS law, and they have a special report out. It's quite interesting. I think the Mental Health Board should be aware of that report and read it. There is a lot of discontent because there are many people feel that, like these families, there is nothing they can do because they certainly don't meet the criteria for care that is court ordered. And I know there's huge concerns about patient rights, but there's a need to be informed about this. And I would just like the Mental Health Board to remain active, and I'd love to be involved.
Okay, I know that I see Carol's hand up, and I know that Melissa, you have your hand up too. So I'm going to have Melissa go ahead, and then you, Carol. Okay, Melissa.
Yeah, really quickly, I think I just wanted to kind of add to that conversation about co-occurring issues in the jail and just getting connected more on that as well, and to include that piece of it. And I don't know if that can be part of those conversations, but I think it's really critical. And, you know, we're having a challenge too on the SUD side to get information about, like, for example, medication-assisted treatment that's happening in the jail and other kinds of services. And we've, you know, had a program that was taking place, counseling program in the jail, and that's no longer. So I really would love to be part of those conversations and see how we can start getting connected again, and maybe doing, again, some integrated services. That's a definite benefit there to have that. There's a high rate of substance use disorder and mental health issues as well. So co-occurring is a big issue there. So just to put that out there on the radar.
Great.
Thank you.
Okay, so Carol, and then Sid has her hand up.
Yeah, I think the other issue that is definitely still a concern, I believe that there was an overturn of the mandate for staff to be vaccinated for COVID, and also if individuals in the jails, I'm not sure if they are being vaccinated for COVID, and the issue around not having any visitors because of COVID is creating essentially isolation for individuals that truly need, you know, socialization as part of their wellness. So really very, very worried about what's going on to individuals being put in jail for behavioral health issues, but also everybody else who's being affected by the impact of COVID.
Sid?
So just wanted to mention too that there's legislation that begins January 1st that folks who have a serious mental illness, who have a misdemeanor, are now, I guess the law is that either they have to be sent to a diversion program in the community or released and charges dropped. No more restoration in custody, which is great. And there was not also more money given to mental health systems to then be able to increase services to be able to serve those folks. So so there are a lot of folks, and judges sort of started doing it within the last couple of months before the law was even in place. So we have a lot of folks who normally would be in jail, and then in forensic programs for either restoration or treatment, who are being released right back out into the streets, without a lot of good connectors, or making sure that folks are connected with services prior to their release. So there's a huge issue there that we really have to deal with, and we are working with the jail to make sure that people are meeting criteria. They come to the CSU, we get them into services. If they're on the pretrial release program, we have Ace and Zamora who does case finding and then works with us, advocates for the court, gives a treatment plan, and works with us to make sure that those folks are getting served. But if they're not on pretrial, folks are being cited out or released or not even arrested in the first place. And it's creating, I know that a lot of families are calling us saying, why aren't the police intervening? Why isn't anyone intervening? There's a whole lot of issues going on with that, because now the police are saying, well, we're just not going to get involved in that in the first place. We're hoping that expanding the in response, we'll pick up a lot of that slack, and doing similar things in other areas of the county will as well. But it's just a very complex thing right now. And I think there's going to be a lot of, until we can figure this out, there's going to be a lot going on. I don't know whether I'm allowed to say this out loud or not, but I'm going to say it anyway. I think that Carla Rodriguez, who has announced that she'll be running for DA, I don't know that anyone else has stepped up. So I think that she may be running, what is that called? Without,
Unopposed.
Yeah,
She is unopposed right now. No one has stepped up as of today. She's still unopposed.
And the really good news about that is that she's very involved in all of this. She comes very regularly to the Stepping Up subcommittee for our county. I talk to her regularly about these issues. She is the behavioral health assigned person in the DA's office, and she has a lot of ideas about how to fix some of these issues. And so I think that she'll be a really good partner if in fact she's elected. So I think that that's positive.
Okay, good information. And I think that, over the years, I think that Guerneville and other outlying areas where it's difficult for law enforcement to bring people in are good examples of what happens if they choose to just leave a situation sit. And because it's difficult to bring people in and they're going to be released quickly anyway. And it, in my opinion, it leaves people in a situation where they are not getting help of any sort. And that has gotten better as, as services have improved out here. And that's gotten better. But over the years, I've seen that in action, and it's not good. Yeah. Michael has his hand up.
This going to Sid. Although yes, I appreciate that it is, I'm sure, an extremely complicated issue. I feel like the solution just comes down to like, well, stuff like the in-response team, it just needs funding. Like, to me, it's as simple as that. It's just like, just provide the funding, and like, okay, we're now not, as you're saying, like, we're not arresting people, we're not sending them to jail. That is great. Like, it's a terrible place that the idea of like getting mental health care in that environment is terrible. But then, okay, well, then we need to fund facilities that act as those transitional places, because these families are asking for help. It is affecting the community. and these people deserve help so they can have a place so they can like, where the only goal is to just like come back into yourself and collect yourself and like get stable again. And so I guess my question, and this is kind of a big question, but it's like, how do you even start the dialogue, or who do you talk to go like, hey, we need more funding so we can help the community, we can help the mental health community? Like, who do you even begin having that conversation with? Like, who do you talk to for that?
I mean, my answer to that would be the Board of Supervisors.
Yeah.
And then also, you know, we need to be pretty aggressive about making sure that we're applying for all the funding that we can that's funding these kinds of efforts, which is also a real challenge for the behavioral health division, because our administrative support is just really not broad enough to be able to really find and then apply for all those funding opportunities. So it's rough.
Carol?
I just want to remind us again of the funding for the community health workers. I mean, I know it's not a huge amount, but for me, it seems like it is. And community health workers have been incredibly successful, especially through organizations like Transitions Care Network, where individuals themselves who have been incarcerated even before release go through the training to be transitions care providers. And I think it shifts people from being the problem to being part of the solution. So I would like to advocate for us to really look at that model of looking at either individuals with behavioral health lived experience as peer support specialists, or even those that don't have behavioral health issues but are willing to who have incarceration history, that they are trained as individuals that can do the warm handoff. So whether you are released in the morning when services are open, or you're released at 12 in the evening because that's when your paperwork came through, that there is a real life person at the door when you leave to say, do you have a place to go? Do you have money for transport? And can we connect you with a primary care provider? What services do you need? Meeting them where they're at. And because I think there is just way too much money incentive to allow for the revolving door. As long as people are getting money for individuals, the numbers of individuals that are in these prisons, it's just a money-making racket. So I think, yeah, people can be part of the solution, and just would like to elevate community health workers. So Kim called away back again in the hot seat for now. And there is another funding, so, you know, in terms of money for community health workers, there is another pot of money that's coming up right now. In fact, letters of intention by January 20th. And there's several groups in Sonoma County that are potentially looking at this through the California Healthcare Foundation. It's for a regional collaboration across all groups that are using community health workers. There'll be 4 regions funded. And so if anybody's interested in looking into that, I'd be very happy to try and get a conversation going. But it is, the letter of intention has to go in by January 20th.
Okay, that's good to know. And Carol, I know you and I have a mutual friend who has a lot of expertise in community health workers who have lived experience of being incarcerated and also having behavioral health issues.
Okay, so I'm looking at the clock and we've got like 12 minutes left. There's an important job for a mental health board member. January 18th, they're going to be screening applications for the new behavioral health director to take Bill Carter's place. And that's a Tuesday. I'm totally not available on Tuesdays at this point. Is there any, I'm going to be sending an email out, but if there is anybody that knows that they're interested in doing that, please let me know. And it's from I think 8 to 5 or 9 to 5 on that day, depending on how many applications they have. And at the time that I got the email, they already had 17. So there's a good pool of applicants to screen. So I will be looking for a volunteer to do that. There's a possibility that I could take a day off if I really needed to, but I'm sure that there are people that might be interested. So I'll have Tori put the email out. Although if she's not at work, this is pretty important, and I will make sure that everybody knows that opportunity is available. And I told, I think her name is Lisa Lowe, that I would let her know like this week.
Linda Lowe?
Linda Lowe, yes. Thank you. I told her I would let her know who that was going to be. So if you are interested, please contact me. So that if I don't hear from you, I'll be calling people. So there's that. Okay, so we also need to, oh, Carol.
Yeah, I would be interested, but also happy to, if there are other people that are interested, happy for you to choose who you feel is the best person to do the job. But I put my hat in the ring.
Okay, good to know. Is there anybody else that knows immediately that they're interested? I'm looking for hands or something. Nope. Okay, so Carol, I know I've got you on my list there. Okay, so acknowledging behavioral health staff. Any suggestions for who we should acknowledge this month? Okay, Sid, Melissa, and Karen, you may also throw names into the hat, because you know, the people that we normally see all the time, we've honored, I think. So if you know of another person or program that we should be acknowledging, let us know.
Have we done Elise Hempel from Pilima People Service Center?
No.
That's a possibility.
Okay, so I will talk to you, Carol, about more details on that, unless I hear from anybody else. That will probably be what we go with. Okay.
I think maybe Frances has her hand up and Matty has her hand up.
No, sorry, I just want to say she'd be a very good choice, Elise Hempel. She's done a lot for the Petaluma community.
Okay. So Carol suggested and Mary Frances seconded that suggestion. So I'll talk to Carol and maybe Mary Frances to see how to write that up.
I have a suggestion too. I mean, you brought it, I'm new to this, so I don't know, but Erica Chloe, I work a lot with her from Providence, and I don't know if that you're talking about programs. So she's such a good partner and key stakeholder, and has been, you know, involved in so many committees and planning and part of our Petaluma Sober Circle and all that. So I just put her name in the hat, but maybe she's already been awarded. I'm not sure if she's been.
She has.
There you go.
She's everywhere.
There you go. Awesome. All right, thanks.
Yeah, thank you. So that was a great suggestion. Okay, so let me see. Okay, so that's that. So we have just like 5 minutes. I think that I would like to kind of have a kind of know who we're going to ask to present in February. It's, how are you guys? I'm just gonna ask this instead. Michael and Vanessa, how are you doing on your planning?
Good. We actually decided, just because of everything that's going on with Omicron and stuff like that, that we would push to March for everything. We do have like a little slide that kind of shows everything we've been talking about between each other, but we can do that in February if that's better, just because we don't have too much time left. We can go over.
Well, I think that it's okay for you to do either February or March, just as long as we know
Yeah.
if we have, if we're inviting somebody else to present. So if you want to do it in March, that's okay, I
Yeah.
think.
We were still talking about trying to do, because we have a location willing to host. We were trying to do a in-person community event, just because that would be easy to promote, and I think a lot of people would come to that on something around mental health in the pandemic. But yeah, I mean, we have what, 5 minutes? I mean, we can go over the slides now.
Yeah, it's very short. Sorry, not.
No, go ahead.
Yeah, it's very short. It's essentially our idea, which is, how do we communicate with our community? Because there are so many resources, and yet there might still be that stigma of reaching out to these resources. And so I think that's where we're coming from. And also this pandemic, how do we have these conversations of how difficult it's been for everyone? And so as Michael stated last meeting, we were looking to gather, get community members to come together and just open up these conversations for them. And so we were thinking something small that Michael and I could start off, have like a little pilot, and then from there grow into coming up with a bigger, maybe like a community health fair, and focus it on mental health, and have all these resources that we bring to present to these meetings be there. And of course, because of COVID, we're thinking of maybe late this summer or later this summer to have something like that and really plan it out. I do have we have like 2 minutes. It's just all laid out on this. I could share my screen. Can I?
Okay, if it's fast, because
It's just
2 minutes.
It's 3 short slides.
Yeah.
Okay, so
There should be a button at the bottom of your screen.
Yeah, it's disabled. But that's okay. So
Yeah,
that's generally the idea that we're going towards, and to see if this is something the mental health board would be supportive of, if that's one of our roles that we could have, again, just to gather all these resources that we have in the county and open up that communication with the community through a mental health fair later on this year, and starting off with little pilot, opening up conversations with the community.
okay, so I'm just going to say that I'm a little bit worried about an in-person event soon because of COVID.
Agreed.
So I'm thinking that if you guys want to put it off till March, and we can talk more about it at our next executive committee meeting and put you closer to the front of the agenda, so you don't have 2 minutes. And then we just have to figure out who we would ask to do February. And I think it could be either Melissa with her SUD presentation, or the transition to housing with West County Community Services. that is definitely happening and will have been running for a short time. I think that the mapping is more of a look to the future, and if we're ready to do that, I think that that might be a good thing to do for February. Is there, yeah, I see Betsy's nodding, and I see Melissa's nodding that she,
Yeah,
you
I could do
felt.
that. Sure.
So does that sound okay? Carol, quick.
Yeah, so who are we having in January for this meeting?
East County.
East County. Okay.
And
Does
you just
that
send
sound-
an invite, or how does that work? You'll send an invite when you guys decide when you want me there. I'll come, no problem.
Okay, so
Wonderful.
it's looking like that's what we'll do
In February. Okay, great.
in February.
Sure. Thank you.
And then Michael and Vanessa will talk more about your program in our February executive committee meeting. Okay. Okay, so Mary Frances, is your hand still up?
No, I don't know why it's still there. Sorry. No, thank
That's
you.
okay. I'm just making sure. Okay, so I think I need a motion to adjourn even this. So does anybody want to move to adjourn? Carol, second.
Right, yeah.
Michael. Okay, so thank you all, and we will see you later.
Thank
Bye.
you,
Thank you,
everyone.
Kathy. Thank you, everyone.
Thank you. Thanks for coming, Maddie.
Absolutely. I just wasn't sure if I was supposed to be at the executive meetings, but this was nice. It was nice to see everyone.
It's yeah, absolutely. You're welcome to come to the executive meetings and participate and all of that. It's, they're public meetings, so anybody can come, but you'll be on the panel.
Awesome.
Okay.
Well, it's good to see you again. You have a good couple weeks. I'll see you on the 18th.
Okay, bye.